welcome to Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving health and well-being in the city of Chicago. Community Health is presented by the Foxglove Alliance, a public health care coalition supported by the Hectone Institute of Medicine and Hectone's Nurses and the Humanities in partnership with the Healthcare Council of Chicago, which is managed by Third Horizon Strategies. My name is Meghan Phillipp, and I am with HC3, the Healthcare Council of Chicago. Today, our featured guests are Kai Tao and Katie Thiede from iCAN, which stands for Illinois Contraceptive Access Now. Katie and Kai, thank you for joining me today.
Thanks so much for having us, Meghan.
Of course. I asked both of you to join me today, not only because you're doing some tremendous work around women's health and reproductive access, but it is also the month of March, so we are celebrating International Women's History Month. So in all things of celebration of women doing amazing things in Chicago, thank you very much. So let's get started. Let's talk about some of the advocacy and the work that you all are doing with iCAN to support women in Chicago and Illinois. Tell me a little bit more about iCAN's mission and what you all are doing.
Definitely. Well, thank you again for having us today, especially during Women's History Month. We're so grateful to be here. iCAN is a statewide initiative, and we're working to make birth control easier to get in Illinois. Our goal is to normalize birth control as basic health care. And Kai and I know firsthand, because we have a combined 4 decades of experience working in women's health and reproductive health. We also have our own personal experiences accessing birth control. We know that having reproductive autonomy and access to the birth control that we choose, really helps to ensure that we can achieve well-being. And iCAN's work is multifaceted. We are working to do everything from educating community health center and social service providers on how to provide person-centered contraceptive counseling, to educating patients on their, options and their choices, as well as connecting them to care with trusted providers. And then we also are working on really reducing cost barriers through policy change. So we know that there are people who face persistent barriers to accessing the birth control method of their choice because they don't know where to go, who to trust, or if they can afford it. So for those listeners who might be tuning in today and wanting to learn more about how you can get connected to a high-quality trusted provider, you can visit icanforall.org. That's ICAN, the number 4, ALL.org for more information. And just really excited to share more.
So, we talk about trust, and so why is a program like iCAN needed in the state of Illinois?
Yes, so iCAN is needed because even though Illinois has amazing policies and a track record of really protecting reproductive autonomy, we still see there are a lot of gaps for people to be able to access the birth control choice without barriers. Primarily, it comes down to there are barriers when we think about contraceptive deserts. Literally, there's just nothing nearby, to other places where we have hospitals and health systems who have religious restrictions. So you may get your other services there, but the actual birth control for pregnancy prevention is not available as well. And then there's also, because of our history of reproductive coercion, there is a natural and understandable distrust of healthcare providers. And so we are really working with iCAN to think about how do we change how we talk about contraception, where it's more than just you're pregnant or not pregnant, but it's about caring for the person across the lifespan. And so that's what iCAN really does. We talk about how we provide truer care at the health centers, and which we call is reproductive justice in action at the health center. And truer care is our acronym, like many acronyms in healthcare, stands for it's trauma-informed. The R is respectful. The U is unconscious bias checked. The E is evidence-based or evidence-informed. And then the last R is reproductive well-being centered. So we are really focused on making sure that in Illinois, all people, when they access high-quality health centers. We work primarily with FQHCs, that they will receive truer care.
Yeah. Another thing that we think about beyond just access and trust is other barriers like cost. So can you tell us about the Illinois Department of Healthcare and Family Services new family planning program and how this program is going to help people access birth control?
Absolutely. So we are thrilled that here in the state of Illinois, as Kai mentioned, we do have some great policies. And recently, there is a new policy that is dramatically expanding coverage for family planning and related services. So this includes contraceptive care, but it also includes a wide range of other services like STI testing and screening, annual exams, everything from cervical cancer and breast cancer screenings and colposcopy to, mammography and BRCA testing. So it's a really wide range of services. It also includes HIV prevention. So we're thrilled for this new coverage. The coverage is intended to support folks who, may have existing coverage, but who don't want to use that coverage because of fear of confidentiality concerns. And it's really based on income eligibility. So the great thing is that here in Illinois, if you're an Illinois resident and you make less than $3,250 a month or thereabout, you can be eligible for this coverage. It's for all genders, it's for people of all ages. And iCAN is also working to, advocate for new policies so that this will also support people who are undocumented and on the pathway to U.S. citizenship. Currently, those individuals are eligible for some immediate temporary coverage that will last for anywhere between 1 to 2 months, depending on the date that you apply. So there's some coverage for folks who are undocumented as well. But most Illinois residents today can now have coverage for family planning and related services if they make less than $3,250 a month as an individual. So this is really, really important. We're thrilled. iCAN has been advocating for this policy for years, and it's wonderful that Illinois has now put it into place. I think, as Kai mentioned, we are absolutely an oasis for reproductive health care here in the Midwest, but it's really important to recognize that there are still hundreds of thousands of Illinoisans who are facing persistent barriers to accessing the birth control method of their choice. And this new coverage is going to go a long way to closing that coverage gap.
So I think you talked a little bit about who is eligible, but if you want to explain a little bit more about how people can understand, if you're on Medicaid or what plan you're on and how do you understand if you're eligible and how to navigate this, as well as what are some of the examples of services that are covered? I think you did a great job there, but just to kind of really cap it up for people to understand how they can access these things.
Definitely. So HFS, Family Planning, that's the program. HFS is our state Medicaid, Healthcare and Family Services. And I think the few questions one would ask yourself is, do you live in Illinois? So you have an address here. Are you a U.S. citizen or lawfully on the route to becoming a U.S. citizen? And if you're pregnant, you wouldn't qualify because we also have a moms and baby program, so non-pregnant. And then what Katie mentioned is the individual income that matters. So we don't care what your parents make, what your partner may make, we're just asking you, do you yourself before taxes make less than $3,250? If you answer those questions that I just mentioned and you have that income threshold, then you would qualify for the family planning coverage. And again, that family planning covers all birth control, and I'll just briefly go over some of the birth controls because I think there's a lot of myths and misconceptions out there. Obviously, the most ubiquitous one we often know about is the pills. The pills are the depot shot, are probably the most common ones. So that's covered, obviously. The patch, the vaginal ring, and then we talk about some of the more hassle-free methods, such as the Nexplanon, which is the single rod implant in your arm, or the intrauterine devices, whether it's the hormonal ones or the non-hormonal ones. And this coverage also includes people who are interested in permanent methods, non-reversible methods, for either tubal ligation or a vasectomy. And then, of course, we also want to respect people's choices. And if someone just wants to learn more about natural family planning, they want to use barrier methods, non-hormonal methods, all of this is covered because we want to make sure we do a lot of counseling and education. So that user, if and when they decide they pick birth control, they understood all their options and they're getting the one they want and not what the provider wants or not what their partner wants, right? So those are the family planning methods explicitly laid out. The related services are the ones that you would think about when you go for a routine annual exam, possibly. So it may be a cervical cancer screening if you're at the right age and you need it. STI screenings, here we still routinely in Illinois recommend anyone 24 and under routinely get screened for chlamydia and gonorrhea, because unfortunately we have to do this distinction of having very high rates. We also have all the other STIs that are less prevalent, but still important, including syphilis that's been on the rise. And then we also do HIV screening. Again, that should be done annually or possibly more so depending on your risk factors. So this program would cover all those screenings, the treatment of it. For HIV specifically, they are covering also PrEP and PEP. You may have heard of those acronyms, right? It's essentially meds to prevent you from getting HIV. So either post-exposure or maybe you have a partner or you feel like you may be at risk. And so you can take those meds. That's all covered as well. So it is pretty comprehensive for the average person who may say, I don't have health care. This may help a lot, especially people of childbearing years, which are generally younger and healthier.
I wanted to just add too that this is a lot of information, but iCAN has developed some really great resources on our website. So if you visit icanforall.org, you can not only, take a quiz to help you explore what birth control methods might be best for you, look at all of the methods of birth control, find a trusted provider, but we also have great information on not only this new coverage benefit and program, but all of the other coverage benefit programs that folks here in Illinois might be eligible for to be able to access contraceptive care as well as related, services. So we would really encourage you to visit that site if you're, worried about cost. If you are looking for a provider and want to make sure that you're not going to have some astronomical out-of-pocket costs, there may be coverage programs that you're eligible for, and iCAN has created these resources that are really easy to understand. And you can always also connect with a trusted birth control expert really easy by visiting our website.
Yeah, and I really appreciate hearing more about what's covered to understand that it's for men and women. It's about family planning. It's about understanding that this is about your relationships, and so it can be just as helpful for other members of your family. One last question, and then we can wrap up soon. How do people, go to their provider, their doctor, and say, I saw this episode or have gone on the iCAN website? What are the ways that they can start these conversations and accessing some of the opportunities and things that they may not have realized they could have at their disposal? What are your recommendations to starting those conversations with their trusted providers?
I think, the first place is if you already think you have Medicaid or you had Medicaid and you're not sure, there's been a lot of changes currently with what's happened after the pandemic. Please go to your usual source where you are getting your Medicaid. At that point, you can update your information if you've had any changes, as well as then find out what kind of coverage you have. Our goal is to, of course, people to have full Medicaid, all medical benefits. Because the income threshold is different here, certain people may not qualify. And so on that application, which is through the state of Illinois, it's the ABE, all benefits eligibility.illinois.gov. That's where you can start that process if you don't have any contacts. And then from there, if you don't qualify for full, there is a checkbox that literally says, would you like the family planning coverage if we can't get you full medical benefits? So that would be the important place where you say yes as a default. So that would be a great place for a lot of community health centers throughout the state of Illinois. They have assisters, navigators, financial counselors that can also either help enroll you on the spot or provide you to a trusted provider that can do the enrollment.
That's great. Do either of you have anything else to add about iCAN's work and just how Chicagoans and Illinoisans can really take advantage of what you all are doing?
Yeah, Like we've already mentioned, Illinois is a great leader in advancing progressive reproductive health and rights. This new family planning coverage and the Illinois Family Planning Program with HFS is a great example of yet another way we are working to take care of people here in Illinois. And yet there are millions of people, women and people who can become pregnant who have been denied their access to reproductive health and rights. And that has led to a surge in demand for contraceptive services, including here in Illinois, and especially with the overturning of Roe v. Wade. And we know that decision will also disproportionately affect low-income people and people of color. And so it's really important that now more than ever, folks can easily obtain the birth control method of their choice. And that is what iCAN is working to do, to make birth control easier to get in Illinois. You can't access this coverage if you don't know about it. So we're hoping to help folks, have more information. Definitely visit icanforall.org and talk to your providers as well.
That's great. Thank you so much for both sharing your time today and for the tremendous work and advocacy you're doing for the city and the state. I also want to thank our friends here at CAN TV Nonprofit Services team for helping to produce today's show. My name is Meghan Phillipp. This has been Community Pulse. We are airing on CAN TV Channel 21 and at cantv.org. We will see you next time, so stay well, Chicago.